Hi, this is Dr. Tranchitella. You know, the topic of inflammation is a big one, and it seems to underlie most chronic and acute illnesses. So, how do we address the process of inflammation without suppressing our immune system when we need it, but making sure that our immune system is balanced so that it doesn't attack our own tissue in the case of an autoimmune condition? Outside of autoimmune conditions, chronic inflammation can occur in diabetes, it can occur in cardiovascular disease. So it is a big component of chronic disease, and just the process of dysregulated inflammation can create a situation in which somebody is more predisposed to develop a more acute illness. Um, for today, where we are right now with COVID-19, the people who are more prone to not have a good response or good outcomes from COVID-19 are those who have diabetes, type 2 diabetes, they have insulin resistance, they may be overweight, they have cardiovascular disease, and they have hypertension. And these conditions all have one thing in common, and that is there is underlying inflammation in these conditions, which can lead to their development or worsen their progression. So how do we address inflammation from a very fundamental standpoint? And the things that we can do in our daily lives to decrease that inflammatory reaction so that it responds appropriately when it should, and it's not overreactive to the common everyday things that we encounter in our lives, like food or what's in our environment, so that we're not overreacting and constantly existing in this low level state of inflammation. So one thing that we can start with, which I think is most obvious to most people, is with what we eat, what is in our diet, and looking at some of the pro-inflammatory foods, like a lot of animal products, a lot of meats, a lot of dairy, a lot of simple carbohydrates, and a lot of highly processed and sugar-laden foods. Those can all contribute to inflammation. Also considering other foods like nightshades. For some people who have a diagnosed autoimmune condition, they try to avoid nightshades, which tend to be pro-inflammatory in some people. And nightshades would consist of tomatoes, eggplant, and peppers and potatoes. So those are the foods that can be pro-inflammatory for some people. And those are very common foods. Tomatoes and potatoes are very common in the American diet and elsewhere. So trying to avoid those foods to see if it reduces an inflammatory reaction might be a good idea. Other things to consider are food sensitivities and food allergies. And sometimes we need to test for those things. If somebody has a straight up food allergy, it's likely they're going to know that they're allergic to a food because they get an immediate reaction right after they consume it, or sometimes even if they're just in the same room with it. People can be that reactive when they have a food allergy. But when it comes to food sensitivities, it's not as clear, because you can have a sensitivity reaction 12, 24, 36 hours after you have consumed the food that you're sensitive to. So it's very hard to link that reaction back to something that you ate so long before. So doing food sensitivity testing, IgG food sensitivity testing, can help us to pull out some of those foods that might be adding to a pro-inflammatory state. So that's a very important consideration. Other things to consider are what's going on in your gut. Do you have a lot of gut dysfunction? Do you have a lot of dysbiosis? Do you have a lot of symptoms? Do you have a lot of bloating? Do you have a lot of gas? Do you have loose stools? Do you have issues with constipation? Have you been diagnosed with SIBO? Have you done any stool testing that might help to elucidate where your problems are coming from? Do you have any infections? Do you have parasites potentially? Do you have bacteria? Is there yeast overgrowth that might be contributing to the disruption in your gut? And it's really important to try and identify what the cause of the problem is. It could be something as simple as just bacterial dysbiosis, which we can go in and we can address that fairly easily. But if it's been going on for a long time and somebody is dealing with a lot of issues related to their gut, they can over time develop a lot more symptoms. And just from the presence of the symptoms caused by this bacterial overgrowth or dysbiosis, they may develop something further down the line like a leaky gut syndrome. And with leaky gut, your intestinal wall is more porous and more permeable. So the foods that you eat are not digested as well as they should be. And there's a good chance that you could absorb some of the proteins from your food into systemic circulation, and that can also trigger an immune response. So just about any gut dysfunction could potentially lead to leaky gut, which is why it's important to do stool testing to get to the root cause of the problem. You want to treat the right thing. So looking at food allergies and looking at gut dysfunction is important, and also looking at what is in your environment. What kinds of things are you exposed to? Do you potentially have some heavy metals in your system that you need to get out? Those can also trigger a chronic inflammatory reaction. Exposure to chemicals and toxins in our environment. It's always important to consider what people do for a living and what they're exposed to on a daily basis in their lives. And it doesn't necessarily have to be work-related. People are exposed to plenty of chemicals and things in their own home unknowingly. So evaluating chemical exposure by doing a Great Plains tox screen is a good way to see what kind of chemicals somebody might be harboring in their system. We have good mechanisms in place to try and detoxify the chemicals and things that we're exposed to. But for anyone out there who's got a sluggish liver, or who doesn't have good detox pathways, or they're just not functioning very well, they can tend to harbor and hold on to a lot of the toxins that they're exposed to. And they may be exposed to the same amount of toxins as their partner or the people that they work with, but they may tend to harbor them because they don't have good detox function. So it's important to evaluate that as well. And then also looking at mold in the environment. That's a really big one now, because we know that mold can contribute to chronic neurological problems and just chronic inflammation in general. So when evaluating inflammation, there's some main categories that you have to think about. Diet, what's going on in the gut, heavy metal exposure, toxins, and molds. And all of these things can be easily evaluated and screened for. So do a good workup and get to the root cause of the problem to make sure that you're treating the right thing. I'm Dr. Tranchitella. Thank you.